Hi everyone, mental health. If you look around, there are so many discussions happening on mental health. And if you're in social media, you would see lots and lots of posts nowadays related to mental health, related to stress, depression, anxiety, counseling, and everything. And if you're a simple person coming from a very cultural country like India, you would start thinking, do we really need it, or else is it all a big marketing hype? Let me decode it for you in 2 minutes. Some of you know I'm a life coach who goes all around the country. And nowadays, wherever I go, than coaching assignments, I'm getting people who want to be treated for their depression, for their anxiety, people who have got into some bad habits, and certain things which were a normal part of your life or else were dealt with very easily. Nowadays, they are becoming very big hindrances. And this surprised me a lot. And in my analysis, one thing I have found is most of these things are coming from certain big mistake that we did as a generation in the past. Not ourselves, maybe the previous generation, maybe we are continuing that. We all had a very strong background, a base that was supporting us, and we had coaches in it, we had counselors in it, we had mentors in it. Now, this system was giving us the stability, this system was giving us an inner strength so that we can do anything outside. We lost it as of now. We systematically killed it without knowing. If you're wondering what that is, I hope some of you would have realized it's a joint family system. We had an amazing backbone that was with us, which was supporting us in every single arena of life. Now, I'm not going to dig inside if it was right, was it the need of the hour. Let's just forget it. It has happened, it has happened. The side effects of it are tremendous. We have as of now a very stable income sometimes and very weak assets. The same way, as of now, we have a very strong family bonding as a nuclear family. We don't have extended families, most of us. This is actually giving us a lot of effects. If you go to the US, a person when have a depression or if they are stressed out or else they have anxiety, they don't shy out from going to the psychiatrist, psychologist, whomsoever it may be, and they just go and get treated. Whereas in a country like India, people look them as lunatics if they are going to a psychologist or a psychiatrist. Please understand, psychological health is as much important as a physical health nowadays. Couple of years before or else decades before, gymming was never an important activity. Yoga was never an important activity. Nowadays, even in India, yoga is being sold and gyms are being created every day. What does it mean? There is a need for these things as of now. No businessman will venture into the market where there is no need. So please understand there is a need and this is real. So now what do I do if it is real? First, if you can learn the language of your mind, how you can program it, how you can work out on your own stress levels. Second, even if you can't do that, it is fine. If at all you recognize something that is not working for you, if you need something to someone to talk to about something, please do go for it. Third thing, if you know someone, and this is the most important, if you know someone who is depressed or has anxiety or else has some other issues that you consider that person might be running in their head, please understand, first take them to a psychologist, a coach, or to a counselor. And if that doesn't work, take them to a psychiatrist. Unfortunately, I have come among n number of cases whom they just took directly to the psychiatrist. The results are very sad, but then this is the situation as of now. There is one guy who came to me at the age of 20. They got him to me. Now, this guy was totally aloof. No, he wasn't aware of what was happening around and everything. He was just like, yeah, I will do types. And I was wondering what happened to him. The parents are very proud. At the age of 4, they took him to a psychiatrist who diagnosed him to be a slow learner, and he gave some medicine, and then slowly this continued. He got a bit aggressive. They gave him another medicine. Then at the age of 19, he was even more aggressive. They gave him shock treatments. Now I was shocked. And they were proudly saying we gave him 23 sittings of shock treatment. The parents are it's a normal thing. It doesn't hurt the person because they give anesthesia and everything. Shock treatment is not about the pain that was shown in the earlier days movies. It is about the permanent damage that you can cause to your brain. Not just shock treatment, even the medicines also. So if there is a possibility, this is one thing I have realized. I have had people who have been in medications for 6 months for depression, for anxiety for 3 to 4 months for anxiety issues, and I have worked with them to quit their habit of taking medication, and I have been able to successfully take them out of anxiety or depression. Anxiety and depression are just tip of the iceberg. There are lots more inside. So please understand, these things can be fixed. If you can learn depression, you can unlearn depression. If you can learn anxiety, now the reason I'm saying learning is because one way or the other you have learned it, consciously or unconsciously, which means you can unlearn it. And there is a chance. Please try it. If it doesn't work out, then please go to a psychiatrist or whomsoever it is, if there is no other option. In India, the situation as of now I'm seeing is people are taking their children, their parents, or else anyone else they know directly to a psychiatrist, which is a very, very wrong way of handling things. So my humble and simple request to all my country people is, if you know someone, or else if you yourself experience something, first go to a psychologist, counselor, coach, and if that doesn't work, then go to a psychiatrist. If that doesn't work for a consistent amount of time, because these things works when you, after you have taken certain medications, taken certain treatments, most of the cases, the whatever has happened because of the medication is irreversible, and the damage what is done. So please take care of your mental health as you are taking care of your physical health. It is very important. Take care of the things that you consume in your mind also. Take care of techniques that you can do to de-stress yourself. Learn the language of the mind if you can. Neuro-linguistic programming is an amazing way of learning it. And if at all you have to take a professional support, first a psychologist, coach, counselor, and then if nothing is possible, only then a psychiatrist.